is Ms. Brathwaite. She's going to tell us about racism, weight, stigma, and diet culture and the Black community. Very provocative talk. She's an intuitive eating registered dietitian and intuitive living coach. She has worked with eating disorders for the last 3 years at premier treatment centers. And she's a former program director of nutrition at Turnbridge Substance Abuse Center. And she currently works at Balanced Eating Disorder Treatment Center and has her own business, EAT, Eat for Success. She believes in good relationship with food, which is more important than to fuel. So, and she is a good way to trust your body and your judgment. So I give you Ms. Brathwaite.
Hello. Okay, I'm going to share my screen. So I'm sure that there was a moment where we were like, dietitian, yay, she's going to tell us to eat our fruits and vegetables, and she's going to tell us all of these things. But I think I want to kind of shed light on something a little different, but that's also very important when we think about nutrition. Just want to make sure. Okay, looks like it's up. So today we're going to talk about racism, weight, stigma, diet culture in the Black community. And we're going to go over a couple concepts. Going to try to make it quick because I know that we have just a little bit of time with each other. So first thing I wanted to talk about is Black women have been identified as having the highest body mass index in the US. Many doctors have claimed that Black women's excess weight is the main cause of their poor health outcomes, often fully without testing or diagnosing them. Why does that matter? As we go through this presentation, I hope it will reveal itself. So one of the ways to kind of understand where we are right now is racism in the Black body and how that manifested in the first place. So the roots of fat phobia, or the fear of fatness, are found also in anti-Blackness. The hatred of Black bodies started at the beginning of colonization and the transatlantic slave trade, and the enslaved were forced and removed from Africa and sent to Europe and the Americas, and the created need for whiteness to be as separate as possible from Blackness was really the beginning of when we saw a hatred for the Black body. But before we saw this, prior to the slave trade, Renaissance painters depicted Europeans as shapely, larger bodied, and plump, and that was to show wealth and health. And Black women who have the same bodies they've always had were increasingly depicted falsely in art, representing them as thin and sickly servants who were lowly and inferior. By the 17th century, larger bodies became a trait for racial characterization, and race scientists at the time linked direct ties to gluttony and stupidity to the appearance of African bodies. So this is just kind of the history behind the Black body and how it's been manifested in society. What is weight stigma? So weight stigma is the discriminatory thoughts, actions, or ideologies towards individuals because of their weight and size. And this definitely affects people in the African American communities. It perpetuates misinformed and damaging messages about weight in relation to health. It ignores social determinants of health and has been more consequential to health than BMI or health behaviors. It tells people that dietary control leading to weight loss is the main solution to their health problems. And chronic diseases such as diabetes or heart conditions are mislabeled as lifestyle diseases, when in some cases, they're genetic, more so than, necessarily changing your diet. So I know BMI was brought up previously, but body mass index is a value derived from the mass, the height of a person, and used as a standard of health by insurance. It was introduced in the 19th century by a Belgian man who was a mathematician and not a physician. And he created this formula to give a quick and easy measure of the degree in obesity in the general population, which at that time was white European men, to assist the government in allocating resources. And it had nothing to do with the measurement of health at all. So when we look at how that affects Black people, BMI may misclassify rates of overweight and obesity in historically marginalized ethnic populations. For example, African American women can weigh significantly more than white women and still be healthy. In fact, African American women's risk factors for diseases don't increase until they reach a BMI of 33 or more. That was in a study that I had just read. And the BMI scale indicates that numbers from 25 to 29.9 to be overweight, and those with a BMI over 30 are obese. So when looking at the statistics and where they're pulled from, a lot of them derive from these BMIs and in this current population. Diet culture, or as I like to call it, the killer of self-assurance. You can see on the side there's a couple snacks. I know people have probably heard of like Slim Fast or Skinny Pop, or lean this or clean that. And the names of these items are sometimes more harmful than we think. So what is diet culture? It's the social expectations or pressures that guide how we should eat and how we should look. And if we fail to look a certain way, we're less accepted. Derives from strong beliefs that value thinness and appearance and shape over actual health and well-being. It is everywhere, and some of the places that it can be found are at the gym, social media, WhatsApp, Facebook, your workplace, the grocery store, and even sometimes in healthcare. Some of the things that I've heard and have seen are, you lost weight, you look great. I think that's a compliment, right? The intention is supposed to be fun and happy and joyous. But why is it that the loss of weight means that you look better? What is it about thinner bodies that's more desirable than larger bodies? Especially if health is accessible at each body. Just a thought. Sometimes people will assign morality to food, like this is good and this is bad. And so if you are eating good foods, but you're unhappy with your choices, they aren't choices that you would make generally, and they make you feel like you're not enjoying your food. That's rough, right? If you're going on a diet that says you have to eat a specific way and you don't have any wiggle room to eat the things that you truly enjoy, that's damaging too. And then to say, oh, I'm saving my calories for later, that's actively restricting eating at that moment and saving what would be considered probably a binge for later. And that kind of goes into a different realm of disordered eating and eating disorders. So what is the effect of this on our people? What does that look like? How does that translate? Just want to start by prefacing that there are infinite amounts of effects that diet culture, weight stigma, and racism have on the Black community in regards to nutrition. These are 3, but there are so many more. So one of the ways is that among African American adults, around 48% are clinically obese. We talked about how maybe the indicator for that obesity is a little flawed. But it's interesting because in 2015, a study came out and found that people who reported experiencing this weight discrimination had a 60% increased rate of dying, independent of their BMI or regardless of their body size. 60% increase rate or risk of dying, independent of whatever size they were. It's pretty jarring. Then we talk about our cultural foods. I have experienced, as one of the only Black dietitians in my program, that my cultural foods never seem to be good enough. They never seem to be healthy choices. However, I know that in Barbados, there are a lot of centenarians, which means that they live for a very long time. And there has to be something to that, as they are eating all of the foods that sometimes people will say are the culprit for bodies that appear to be obese. And so much of that goes into how we interact with food, trying to go to dangerous limits to look a certain way, getting surgeries, weight loss things, and even going on diets that aren't even healthy for our body types, because not every body is the same. Another thing that I was looking into was, regardless of income, Black women consistently experience weightism and sexism and racism. And all of these things play into higher rates of chronic mental and physical illnesses, such as heart disease, diabetes, depression, and anxiety. So that's just yet another avenue, right? That racism, that sexism, what is that doing emotionally to us? And what is that doing in our bodies? Is it raising our cortisol levels? Is it affecting our hormones? And what does that do to our weight gain? So now we come to, what are the things that can happen when we're engaged with this on a day-to-day? There's disordered eating versus eating disorders. Disordered eating is the step before an eating disorder. Some people can actually stay in that stage for a very long time. And it looks like eating for reasons other than nourishment or hunger, eating to deal with stress and difficult emotions, engaging in calorie restriction, binging or purging, which is throwing up infrequently, and then avoiding major food groups or only eating certain foods. And this is definitely not a good relationship with food, but it doesn't necessarily, it's a red flag, but we're not there yet. We're not at the worst case scenario, which could be an eating disorder. And an eating disorder is constant and obsessive thoughts about food, extreme concerns about calories, significant changes in weight, obsessive thoughts related to the shape and weight of our bodies, and then impaired functioning due to counting calories, binging, which means eating a large amount of food until the point of sickness, purging, which means vomiting, over exercising excessively to compensate for eating. And then there are other behaviors that are ensued. I want to speak a little bit to eating disorders in the Black community. It is taboo and still very hard in the Black community to talk about mental health. And because of that, the eating disorder is a mental health issue, and the target it chooses is food. And so many people have a "I will struggle in silence" mentality. I will not succumb to what I'm struggling with. I don't have time. I have things to do. I have an entire life that I need to live to prove that I'm somebody. And so I can't let this thing get in my way. And so, unlike white counterparts, they suffer more from anorexia, which is, by the way, the rarest. Not that it doesn't happen in the Black community. There are several books that are written by Black women and men about having anorexia, but that's one of the rarest types. One of the most popular types of eating disorders is binge eating disorder. And that is the consumption or the overconsumption of food past the point of fullness. And it causes a lot of different things. Shame, right? Shame out of that being the coping mechanism. It causes isolation. You don't want to tell anyone you're doing this thing. It comes from stress. And we know we have no shortage of that as Black people. We have no shortage of stress. And so it's important. It comes from food insecurity, right? Which is yet another thing that plays into this. I know I might not have this later, so I have to have it all now if I have a chance. There are so many things that play into this eating pattern. So then, nutrition myths and how we move forward. This section, and before I get to it, I just want to read something. What we eat is personal choice based on taste preference, accessibility, socioeconomic status, cultural influences, and in some cases, information from a qualified nutrition professional, not social media and others' personal experiences with food. I see a lot of people going on and saying, hey, I did this diet and it worked for me, so it should work for all of us. And it's important to know that nutrition is super individualized because everyone is different. It goes as far as genetics, which is the most individualized we can get, right? No one has the same DNA, not even if you're twins. So there are a lot of myths and things that I hear as a dietitian that diet culture leads us to believe. And even sometimes science leads us to believe, because science is evolving. It doesn't stop. We don't just know something definitively. Throughout the years, we figure out things and we continue to discover new experiences and understandings of how things work. So these are just 3 that I have recently heard, and I wanted to kind of myth bust a little bit. Egg yolks should be avoided because they are high in cholesterol, which drives heart disease, or high cholesterol. Cholesterol in the diet has little to no effect on cholesterol in the blood. Harvard actually just, well, it was a while ago, released a study that showed that. And studies have shown that eggs raise the good cholesterol, which is the HDL cholesterol, and don't raise the risk for heart disease. And just to let everyone know, eggs are one of the most nutritious foods that we have. And because of that reason, most of that nutrition is actually in the yolk. The only thing that's in the egg white is the protein. And so we're missing out on a lot of different, especially for women, a lot of different nutrients that we need. And so my question is the problem the egg, or is it our relationship with the egg? Saturated fat raises LDL cholesterol in the blood and increases the risk of heart attacks. Recent studies have shown that saturated fat is not linked to an increase of deaths from heart disease or stroke. Saturated fat raises HDL, which is the good cholesterol, and actually helps to reconfigure LDL cholesterol. And when we talk about saturated fats, I hear people say, oh, saturated fat is like meats and it's milk, and it's also avocados. It's also coconut. So when we talk about saturated fats, there are different kinds of saturated fats, just like there are different types of fat. And I think it's really important to go to a dietitian, right? Because these are the kinds of things you learn there. I had a client who came to me and was crying and told me that they couldn't eat a banana because it had too much sugar. And then I had another client who came to me and said that they couldn't eat white rice. And I said, okay, we're going to stop. The banana has a lot more than sugar. It's comprised of a lot more. And also we can fit a banana into your nourishing meal plan. And as for the white rice, this woman did have diabetes, and there's a concept of balancing your foods. So if you add beans to that white rice, you now have a complete protein. That's going to break down differently, right? The white rice alone might break down a little faster and spike the blood sugar, but if we cut it in with some protein, we cut it in with some fat, that's a completely different, mix of nutrients. So this is why dietitians are important to go to, especially when you're having questions. And if you trust Dr. Google, he will tell you everything and you'll be overwhelmed and it'll just not be a great day. The last one is losing weight is all about willpower, eating less and exercising more. Weight loss and weight gain is not about willpower or calories in versus calories out. Weight loss is due mostly to genetics, hormones, and other various external factors. I'm not saying that changing the way you eat could never change your weight, but I am saying that there are a lot of other factors. Our bodies are multifaceted and highly complex. And just as a caveat, I had a client who came to me and had anorexia. her BMI was 25 and she was told that she was doing great. Meanwhile, she's throwing up 3 times a day, not eating anything for hours on end, and in what I would describe and what she would describe as personal hell. But because her labs looked miraculously okay, I can't really understand why with throwing up, but because they looked okay and because her BMI was fine, she was unnoticed, unseen, and no one really flagged that for her. I do want to also make a disclaimer, and it is at the bottom, that if you do have, some specialized medical issues or diseases that are present, that does change things. There are times when we do take a different approach. But for the most part, while we're taking these approaches, we really need to make sure that we're individualizing it to everyone. I'll tell another personal story. I went to a doctor once and they said everything looked great, but I needed to lose 5 pounds. And this is not anything against any clinicians or any doctors, but it was one of those things where I thought, wow, if I really was struggling with an eating disorder, which is more prevalent than we think, what would that have done to me? Instead, I just gave them a couple articles and they said they would change how they talked about food with clients. And that was like the best case scenario. So, okay, we've gone through all of this. Obviously, this topic is a lot. It has a lot. I would prefer to be able to go more in depth, but I know we have time constraints. And I also want to say that there is so much I did not get to say. But I will say, if you feel like any of these things, if you know there's a problem, if you know someone who has a problem, if you want to know if you have a problem, there are some resources in this PowerPoint. You can go to NEDA, which is the National Eating Disorder Association website. They also do try to be more inclusive with cultures and different ethnicities. It is as recent, but they're trying. If you feel like you are at a point where you're like, I definitely might have a problem and I need an assessment, you can click on this link if you get the PowerPoint. And that is basically going to show you every single eating disorder treatment center in the United States, wherever you are. Read these. These are Google Docs of books written by Black men and women about all of what I just said, also eating disorder stories and how that's transpired in their lives. And then also, if you want, you know where to reach me, eatforsuccess.com. And that's also here as a place as well. And then there are just lots of references, as all of this needs to be backed up by sound science and research. Alrighty.
Thank you so much. A lot of information on nutrition and food shaming and weight loss. So very, very informative.